So, welcome back, ladies and gentlemen, to the TCM community. And today we're here with Dr. Poney Chiang, who is a renowned acupuncturist and scholar with a unique blend of expertise in both biomedical research and traditional Chinese medicine. He also holds a PhD in biomedical research from the University of Toronto and a master's degree in TCM, traditional Oriental medicine from the Pacific College of Oriental Medicine in New York. Now, Dr. Chang is particularly well known for his pioneering work in neuro-acupuncture, which is the gap between Eastern and Western medical practices by applying neuro-anatomical knowledge to acupuncture techniques. So, a very warm welcome, Dr. Poney Chiang. Welcome to the channel.
Thank you, Lopi. Thank you for the invitation. It's an honor.
Well, the honor is ours. You developed also different techniques and for example, could you explain about the neuromodulation needle technique you developed and how they compare to modern traditional acupuncture practices?
Okay. So neuromodulation needle technique involves application of electricity to a nerve. It can certainly be achieved by manual stimulation, like rotation, pitch, lift, and thrust, to create a tingling sensation, paresthesia. Like, for example, if your needle spin 9 or pericardium 6, sometimes you get a zinging sensation down the legs, sensation down to the palm and fingers, right? That's what I'm talking about. That's the sensation of the nerves. But that's the sensor aspect of that nerve. Nerves also have a motor aspect. So sometimes, so when you apply electricity to a nerve that has both sensory and motor aspect to it, that nerve will carry the electricity down to not just one, but usually several muscles that is involved in innervating. So you will see certain predictable movements. Like the radial nerve is going to go to the wrist extensors and finger extensors and thumb extensors. That's the same no matter where and what period in time. And so we know what's supposed to happen when you stimulate that. And that would be very useful for, let's say, somebody who has muscle weakness due to repetitive strain. It could be great for athletic performance, but also for, like, let's say you have a neo-rehabilitated population, like a stroke patient, for example, that has certain type of weaknesses and spasticity, paresis and spasticity. We can use nerve trunk stimulation to neuro patients, right? So the motor aspect is very important. The sensory aspect is obviously more for pain and nerve entrapment syndromes and things like that, which is very important for quality of life as well. So using acupuncture points to target nerves is not original to me. It's other people do it too. I mentioned some of my mentors are the ones that first introduced me to this idea. But what I've done is I've systematized it so that we can teach how to stimulate this nerve in a way that's reproducible. It's easy to learn, and so that students know what is expected to happen before it happens. Because the nervous system would dictate, this, let's say the radial nerve goes to the thumb and index finger on the back of the hand, then that's kind of like the lung channel. So you would know ahead of time what needling lung 7 should be, their sensation should be like. So it doesn't matter using it for, so people kind of misunderstand that this is only for orthopedic neurological problems. So as long as you're using acupuncture points that are the primary points, that's the channel ones, not the ones extraordinary, the ones out of the channel or special family system like tone style, for example. None of the WHO standardized points. Those points obviously can be used for physical purposes, but also have internal medicine applications. But it's all the same structure, it's all the same nerve. So if you want to use lung 7 to release exterior, for example, you still need to have the bright dirty sensation for that. Whether you're using it for treating a pain of thumb or using it for releasing exterior, it's still got to stimulate the lung channel or stimulate the radial nerve to create that dirty sensation, right? And lung 7 is not just for releasing exterior. Lung 7 is a low point too. So low point is supposed to have a path to the thenar. That's according to channel theory. Turns out, based on my research, that there's actually a branch of the radial nerve that goes to the thenar. And so it's probably not a coincidence that ancient acupuncture passed on these channel theory. It's actually on either dissection they did or from needling sensation that they experienced, right? So knowing that lower point of the lung goes to the thenar. That means that we need a lung 7. If it's the lower purpose that you chose that point, then it won't do you any good to get dissection into the index finger, for example, because that's the large intestine, right? You need to have dissection going to the thenar. Then you will have the benefits associated with the lung. Or let's take it further. Lung 7 is also the confluent point with the Renmai conception vessel. So if you're using that for that, then it wouldn't make sense for you to release the exterior or go to the thenar. That's the lower aspect. So understanding the anatomy and informed by the channel theory tells you what needle technique and Dutch sensation you need to get so that you'll get the right list of indications associated with conception, with the conception channel, with lower channel, or large intestine lung channel, right? So otherwise, anatomy is kind of boring, I have to say. Even though as passionate and as geeky I am about anatomy, it has to be applicable. So we learn anatomy only so that we know how that changes our needling and our dirty sensation, so that we can have reproducible results and greater efficacy in whatever it is indication you're going after based on your TCM diagnosis. So I have some examples of videos I can show you of what nerve stimulation looks like. So I've decided to show you something from the face using the facial nerves. Okay, so let me just. What you're seeing here is actually sort of the artistic rendition of a diagram that has since been published in medical acupuncture a couple of years ago. And what it is the path of the facial nerve, cranial nerve 7. As everybody knows, it emerges from behind the earlobe at Sanjiao 17. This is labeled Sanjiao 17. But it would branch into different parts of the face. These are established neuroanatomies, such as temporal branch, buccal branch, cervical branch, etc., etc. And what I have discovered is that these branches very conveniently fall in the places where acupuncture points are. So I've done a lot of work like this to show that it's not a coincidence that these points just happen to be where the nerves are. It is actually the reason why these points are there. So here I'm just showing you for the facial nerve. I mean, there will be points that are related to trigeminal nerve, for example, down the face, so on and so forth. Okay, and what I want to impress upon you, like even tiny bunch of the small points around the ear in the Sanjiao channel, like Sanjiao 22, Sanjiao 20, 19, they actually all turn out to be specific nerve for specific ear muscles, posterior auricular muscle, superior auricular muscle, and so forth. So once you see this, somebody who's reasonably educated will realize, okay, this cannot be a coincidence. So if the purpose of the acupuncture has been passed down for us is to target the nervous system, maybe I should go back to the books that's been gathering dust since first year anatomy TCM school. Just go back and look at the anatomy, because studying anatomy is actually studying acupuncture. And so let me just show you a video. This is Sanjiao 17 behind the ear. And as you saw earlier, it activates all the different branches of the facial nerve. So you'll see complete activation of the face. You see the eyebrows raising. That's the frontal branch. Okay, you see the eyes closing, that's the zygomatic branch. You see the cheeks pulling up, the buccal branch. You see the chin activating, that's the marginal mandibular branch. You even see the platysmal muscle of the neck engaging, that's the cervical branch. So it's a point, it's kind of like a grandfather point that covers all the branches. And it actually even colors some of the posterior branches too. There are some branches that goes to the back of the scalp and the point, as I mentioned, muscles around the ear. You can watch that the ear's being pulled back. The ear's actually elevating a little bit. It's because it's firing all muscles. Okay. And so obviously this has direct application to like things like Bell's palsy, right? And facial paralysis for stroke and things like that. But if you understand neuroanatomy, that facial nerve is not just for motor movements. It's actually responsible for sense of taste of the anterior tooth of the tongue. It's actually responsible for the parasympathetic aspect of the face, the head. So everybody knows vagus nerve is related to the parasympathetic nervous system, and it's said to be the 90% of the body parasympathetic nervous system. What's the other 10%? The other 10% is facial nerve, glossopharyngeal nerve, and oculomotor nerve. But facial nerve is the primary one for anything. So like
Mm,
dry eyes, your dry mouth, the salivation, glandular secretions, secretory things are all parasympathetic nervous system. So if you understand the neuroanatomy, Sanjiao 17 now can be used for dry mouth or dry eyes. We've used this for post-radiation therapy, where people have xerostomia after post-radiation therapy for pharyngeal cancers. And
mm,
and we use this to restore loss of sense of taste post-COVID because of the neuroanatomy. So this research, by standardizing what points are which nerve structures, if you then go understand the neuroanatomy, you already know where you need to go to target certain problems. And by by formulating a way to teach these techniques and practicing them, you of course takes time to practice on your own too. But having done this myself and taught this, we figured out ways to get this quickly. In fact, it was actually during one of these workshops that I conducted that we were teaching students how to do this Sanjiao 17 point. And one of the students in class, a colleague of mine, has had unilateral tinnitus for 15 years, and immediately wait. And we know this point can be used for tinnitus, but so is all the other points around the ear. It's not very
yeah,
specific.
right.
All the points around the ear to treat tinnitus, otitis media, hearing loss, et cetera. So the reason why Sanjiao 17 or the facial nerve can affect tinnitus is because there's actually one of the three bones in the tiny bones of the ear, one of the ossicle bones, one of the bones called stapes bone, and it has a muscle called stapedius muscle. That muscle is activated by the facial nerve. So being an acupuncture nerd and neuroanatomy nerd, I already knew that. So I always have thought that Sanjiao 17 has the potential of affecting tinnitus because it can change the tension, known as myoclonus of that muscle, that's known to cause tinnitus. But it wasn't until seeing it in the classroom that I knew it could be done. Right? In theory, it could be done, but I saw it done. Then that made me realize, all right, so I should start applying this to my tinnitus patient and teaching, letting my students know that, let them treat their tinnitus patients. So over the last 5-6 years, we'd be beginning to expand our toolbox. And so Sanjiao 17 is now, has multiple diverse applications, but it's not just like, okay, you have tinnitus or your dry mouth, not just Sanjiao 17. You have to have the activation of the face. Otherwise, you're simply in that neighborhood. It's like a drone flying over a building. You're getting a two-dimensional view, but you know what building, what level of that building the VIP is located, right?
Right.
So you do have to have the right depth, sometimes right angle. So, and then of course with confirmation, otherwise you put it in, you're kind of hoping for the best. That's where the patient comes in, you really confirm. So I tell patients, I know you don't have a facial problem. It's not what I'm here for. For me to confirm that I'm really getting the nerve that's responsible for your tongue taste or you hear tinnitus problems, I need to check a little facial movement. And then we know that we've really done our best. This is how it's reproducible. Because you know what's going to happen, you confirm it happens, and then now you do that every single treatment, then you have a dosage effect, and then the results are going to be there.